Hi, Yamelly. Today I'm responding to your post. And I agree with you. In some cultures, there are attitudes and gestures that can be seen as disrespectful, but some others may not. You mentioned things such as eye contact and tapping someone in the shoulder, like touching. That's something that, for example, in my culture, when you don't look somebody in the eye when they're speaking to you is a bit disrespectful. It seems like you're not paying attention or you don't care what the person is saying. But then from for other cultures, this may be a sign of disrespect, or it's something that they might feel uncomfortable because their culture doesn't allow people seeing you direct in the eye. So it depends. It varies from culture to culture. Another thing is that as helpers, we have to be aware of those things, and we need to know like the background, the history, and the culture of our patients, so that we don't do those mistakes. Because I know this can affect the therapeutic alliance. So, for example, I also think that we can ask the client about their culture and what makes them uncomfortable, what makes them feel maybe threatened, or not threatened, but make them feel not comfortable. So that's something that we can ask as helpers and tell them, like, tell me if something that I do may maybe a gesture, maybe something, a body language that you think is a sign of disrespect. You can let me know. That's some things that we can have in mind when we are seeing the client. Also, you mentioned nonverbal communication, such as touch. For example, I personally believe that touch cannot, well, not cannot, but yeah, no, it cannot be part of therapy because, for example, many people might think in some other ways, they might think, and they can even accuse you of harassment for the worst case. But what I'm saying is that when you work with clients, you have to be very careful. I don't think we have to touch in any sense, especially in this culture, in American culture. Where you touch somebody is a big deal. So I don't think as professional counselors we can, but like I said, it all depends on the culture. Because like Layla said, her post, that in Brazil is something that is, it's something that is good in Brazil to touch, to care, to feel the person. But like I said, in this culture, not is not that is not that agreed. So I don't think this type of nonverbal communication is needed in therapy because you don't want to make anybody uncomfortable, and you don't also know if the person is going to feel uncomfortable or if the person is going to think the touch is going somewhere else. So this is my post to you, Yamelly. Thank you.